Good afternoon. Well, more, of course, on our developing story this afternoon. The finding by Judge Mmonoa Teffo in the High Court in Tshwane that the former Gauteng Health MEC, Qedani Mahlangu, and former head of the Mental Health Directorate, Makgabo Manamela, are criminally responsible, liable in some ways, depending on how you look at the legal language, for the deaths of some of the people who died, at least some of the people who died in the Life Esidimeni tragedy. Veronica Makhoali, part of our team covering this with us today. Veronica, afternoon again. So many things to look at with this. We've just heard there from an attorney a moment ago telling us that it will still take a very long time before criminal charges could be brought, before there's any kind of closure in this case.
And certainly, Stephen, I think that is the reality of our own criminal justice system and how it works. But I think while that is the truth, what has been said by Judge Teffo this afternoon essentially may, of course, not bring the lives back that were lost, and it may, of course, also not bring, take away the indignified way that many of those patients died. But what it does do, Stephen, I think it provides accountability. I think it gives an opportunity to say, as a family member, as South Africans, as people who want to hold leaders accountable, to say, former MEC Qedani Mahlangu, that this was caused by you. And this is coming, of course, from the judge, saying that you did not necessarily do your job to the best of your ability. You did not consider essentially the patients and what they would have to endure in the long run. And I think, Stephen, for anyone to have that hanging over their head is in some way not necessarily closure enough, but it gives us an opportunity to say we know who to look at when we want the questions.
There's so much more to come in all of this. And I mean, if you look at the reaction from the Treatment Action Campaign, their Gauteng head telling us a few moments ago that this was, in their view, this is their view, that this was sort of driven by greed. We've never really got to the bottom of what was actually driving this. And yet, Mahlangu's answered questions under oath. There have been questions around all of this. I think for many people, this is still the fundamental question. It's a question that often happens in these cases. Why did this happen? And despite two processes, we're not actually as close as we need to be to finding out why it happened.
Yeah, and obviously at the heart of it and what they said during the inquest was that Gauteng, as we know, has been, going through some budget constraints. And Mahlangu as well, obviously saying that the reason why they took that decision is that you'd understand that the Life Esidimeni facility was a private facility, and that they felt that, no, we could work with NGOs and we could work with other sort of, health facilities to cut the costs for, the government. And I think even during the inquest at one point, we heard about how at least for one patient, it costed about 112 Rand per head per day. And that's essentially what the government was trying to do, to cut the costs. But Stephen, where we stand today, was cutting the costs all worth it, considering the many lives that were lost? And still, perhaps maybe that would have still been in good faith in terms of the health department wanting to, of course, keep their budget afloat. But what then happened afterwards? Scrambling to move almost 2,000 patients. What was the lack of follow-up? Knowing the conditions, why then, if you also had seen those NGOs, if you also knew that there were not necessarily enough staff members that were equipped in terms of helping and dealing with mental health care patients, where was the follow-up? Where was the equipping then the NGOs to say, we know what is missing, let us fill the gaps so that we don't have to pay the price and see ourselves sitting here today having this discussion?
There's, I'm sure, going to be a lot of pressure and a lot of directions after this. Qedani Mahlangu has hardly spoken in public since this happened. I can remember, I think, one meeting almost as if by chance with President Cyril Ramaphosa. This was many years ago now. Other than that, we might only hear communication through her lawyers. But the fact is that now there will be demands for accountability from her. David Makhura, of course, was the Gauteng Premier at the time. He pledged to walk until the end of the road with the families of the Esidimeni victims. He's also testified in these processes.
Yeah. And I think that's really important as well, Stephen, to mention in terms of the other role players. While the judge has mentioned these two key role players, as well as the owners of some of the NGOs so far, it's also important to understand that there are also others. You may not have been mentioned right now in the outcomes of this inquest, but what was your role thereafter? I think people like the former Premier, David Makhura as well, having been at the head of the province at the time, where is their accountability as well, Stephen?
There's going to be many questions as well about whether or not something like this could ever happen again. And I remember at the time there was actually going to be a similar procedure underway in the Eastern Cape, and that was stopped very quickly. I think Dr. Aaron Motsoaledi was the health minister then, and again now, coincidentally, played a role in that. Others would have as well. But the point about following up, if you release patients into the care of people, is anyone looking after them going to actually inspect? I mean, who took the patients there and left them there? What did they do? We've seen testimony from other people, from the Society, the Association of Psychiatrists, from SADAG. They all tried to stop this, and tragically, a High Court allowed the Gauteng provincial government at the time to go ahead.
And I'm glad that you bring up the point of saying, you know, how do we prevent another Life Esidimeni? I think what today's outcome will also do, Stephen, and as you speak about follow-up, if you speak about, you know, in terms of the long-term consequences of what happened, of the decisions that were made, it's important to note, Stephen, that Life Esidimeni is not just a stain in terms of South Africa's democracy, of the lack of care for mental health patients. It's generally also a stain on the lack of care of residents. It speaks to the larger and broader issue of what happens when we have, you know, governments and leaders that are neglectful to its people. It's also a story about the lack of dignity that often many people face when they go through, be it healthcare facilities. And when you speak of the issue of Life Esidimeni in itself, it's not just what happened to these 144 patients, but it is also the bigger story of what every day ordinary South Africans are having to go through when they are seeking the services that they require.
Veronica Makhoali, thank you very much indeed. Part of our team, of course, following this particular issue.